Good afternoon and welcome to this week's Power Hour. My name is Christina Napagdag and I am from the North Carolina Medical Society Foundation. I'm here today together with my colleague Aubrey Cuthbertson as well as Franklin Walker, who is the moderator for this session as he always is every week. The purpose of the Power Hour is to really focus on having conversations, important conversations around topics that are particularly important right now, but also topics that are inspiring or that are informative, and just for the variety of the topics that we will bring to you. We are also focusing on this through building community and through building collaboration. So today we will discuss some of the new HR challenges that are rising because of COVID-19 and how to address those. And the guests today are Kelsey Mayo, Kevin Seslowski, and Steve Shaber from Pointer Sprawl. And just before we start and I hand over to Franklin, I would like to remind everybody that we would love for you to chime in. If you want to do so, please unmute yourselves and just feel free to ask your question or comment, or you can also use the chat box that we monitor. And if we don't get all of your questions, we will make sure that we somehow address your question after this session. This session is also going to be recorded. You should be able to find it on the KIPL Institute for Physician Leadership landing page sometime midweek next week. And with that, I want to thank you for being here today, for being with us, and thank you to our guests for taking the time to be with us. And I'm going to hand it over to Franklin Walker.
Thanks, Tina. Welcome, everybody, to our 7th edition of Power Hour over this time of the COVID-19 pandemic. And as Tina said today, we're going to be talking with 3 esteemed attorneys about human resource stuff and how COVID has affected it. So let's, without any delay, go ahead and get into it. We know that during this COVID pandemic, the vast majority of medical practices and other healthcare facilities have experienced a significant drop in business, anywhere from 40 to 80%. And in many cases, this has necessitated the reduction of the workforce by layoffs, furlough, or terminations. And I know that we have received a lot of questions at the Medical Society on the difference of, what's a layoff, a furlough, or a termination, and which avenue the practices should take. So I'd like to start with that. And Kelsey, could you start out with that and talk about the difference between layoffs, furloughs, or terminations, and discuss the advantages and disadvantages of each? Thank you.
Yeah, sure. I will kick it off, and I'm sure Kevin and I will probably go back and forth on a lot of these questions, so he'll jump in here.
Sure.
But essentially, right, a layoff is going to be a termination of employment, and there's particular ramifications that you have to be aware of if there's a termination of employment. It will usually trigger things like, termination of benefits, and therefore, COBRA elections, things of that sort. Whereas a furlough is going to often be more of a leave of absence, where there's not a termination of employment oftentimes, but rather it's a continuation of employment. They're just not currently providing services, and that can have sort of the other side of those ramifications, where if there's not a termination of employment, benefits may not cease right away. They may not be entitled to things attendant to the termination, such as out of leave or distributions from retirement benefits. And this is a facts and circumstances analysis, and so that's where I think I'll turn it over to Kevin to talk about maybe the differences between those two and the advantages from the employment side.
Sure. So as Kelsey said, I think this is 2 things, not 3. You have a layoff or you have a furlough. It sounds better sometimes when you message it to employees as a layoff, but effectively you are terminating them. So I don't think there is a 3rd category of termination. You have a layoff, which is a type of termination, or a furlough. In terms of the main difference, Kelsey talked about the main benefits difference in terms of what it means for benefit plans and healthcare continuation. From a straight employment standpoint, probably the biggest difference, if an employer is deciding which of these things to do, is if you lay off employees and you have some obligation to pay out sick or vacation time or PTO at the termination of employment, you're going to owe them all that money immediately. Whereas if you furlough them, potentially you don't have to make those payments. And given the state of the economy and how cash strapped a lot of businesses are, there's probably some benefit if you can do a furlough to not having to incur the payroll cost of paying out all the PTO. Typically, a furlough is described on the front end as for a particular period of time. So we are reducing your hours to 50%, or we're reducing your hours to 0% for the next 6 weeks, 8 weeks, whatever the case may be. At some point, you can say that on the front end and mean it. If you never bring them back, the furlough will effectively convert to a termination at some point. Layoff is typically going to be messaged as, unfortunately, we don't have any work for you. We're having to let you go. If and when things improve, we'd love to consider any application you might put in. So it's a sort of total severing of employment. In terms of what's not different between the two, certainly right now in North Carolina, if you're making a furlough or a layoff because of COVID reasons, the unemployment benefits available to employees will not be any different regardless of which choice you make. So you can furlough employees and they can go down to DES and apply for and potentially receive unemployment even though they're still technically employed. So if that is a determining factor, that's one thing to consider, that you can keep them attached to your employee roles and they can still get the benefit of unemployment without having been laid off.
Right. As a follow-up to that, the medical society typically represents independent physicians who have their own small businesses, medical practices, and I was wondering if in what the difference between furlough and layoffs and terminations, is there any nuance between a traditional small business, maybe a tire shop and repair shop for auto, and a medical practice?
So Kelsey, let me know if you have a different thought. My reaction to that question is no, that in terms of the various laws that would come into play if you're furloughing or laying off, the type of business you're running, whether it's by or by size of business, should not matter, except for in some cases that are probably beyond the scope of this, like, are you big enough to have a mass layoff under the WARN Act? But if you're laying people off for COVID reasons, that federal law probably doesn't apply anyway. So I can't think of any clear case in which it would make a difference. Kelsey?
Right. Yeah.
No, yeah, the only, and this is more of a practical difference, not a legal difference between, practices and like the auto repair shop. With a lot of these small businesses during the COVID times, they just weren't open at all, whereas some practices maybe were sort of on call. And so, the need to furlough rather than lay off maybe was there, just sort of, Kevin already laid out a lot of good reasons why you would want to furlough anyway. But I think, potentially, the nature of a medical practice that was continuing to operate just on a extremely reduced level, it maybe makes the furlough even more attractive than it would be for those other small businesses that you mentioned, Franklin.
Right. And one more follow-up, if I may. We'd also know that when employees file for unemployment, in certain circumstances, that affects a business's unemployment rating, right? So as you guys tick through the furlough and the layoffs and the termination, is there any advantageous position for that to say, select a furlough so that my unemployment insurance won't go up?
No, so almost certainly not. Governor Cooper issued an executive order, I should remember but cannot remember the exact date. I think it was April 17th, 5-6 weeks ago. And the point of it is, one of the things in the executive order was a statement, a new rule, that if employees are laid off, furloughed, or terminated because of COVID-19 related reductions in business, any benefits they receive will not be charged against the employer's unemployment tax account. So, the trick is, can the business prove that the layoff was COVID related? My guess is, given how overwhelmed the Division of Employment Security is, as long as you say that's the reason, you're probably not getting charged on your tax account. I don't think they're going to be in a position to do deep dive audits. And I think there's some recognition that if businesses are laying people off right now, it's very likely related to COVID. So it sort of makes it turning the traditional thing on its head to some extent, where instead of discouraging employees from applying for unemployment, there actually may be a lot of benefit in terms of employee relations to encourage them to apply and to point them to the website for where to go do that. Because if they get benefits, that's not hurting your tax account.
Right.
And Kevin,
That makes
am
a
I
lot.
remembering?
Go ahead.
Am I remembering
Go ahead.
that unlike normally, I mean, you can get unemployment right now, or maybe that pandemic unemployment, even if it's just a reduction in hours?
Correct. So actually, you could always get unemployment in North Carolina if the hours were reduced by a particular amount, which is 60% or less of the normal schedule. So that rule has not changed, but the tax treatment for the employer has changed. I mean, typically before COVID, that's going to land in the employer's lap, right? I mean, it's generally not going to be the employee's fault if his or her hours get cut. So the employee is going to have the tax hit from those benefits. Now, if you cut hours because of COVID, the employee gets partial unemployment benefits. Those will not be charged against the employer account. And one quick point of clarification. So there is a federal supplement to unemployment that was part of the CARES Act, and I think we'll get into the CARES Act in some detail here during the next part of the call. But under the CARES Act, employees who are receiving unemployment benefits under state law can get an additional $600 per week from the federal government. And that is, in case anyone was concerned or curious, that is absolutely not charged to the employer in any way. It comes straight from the federal government. Whether your employees get it or don't, it's not going to affect your tax rate.
Okay. Tina, do you have a question?
Well, you froze up on me a little bit, so I apologize if you may have said this, so this might just occur as completely not relevant, but I was thinking, and this is not necessarily related to COVID-19 per se, but the aspect of furloughing and layoffs and stuff like that. Is there a difference between non-exempt and exempt staff? And how do you go about that?
For unemployment purposes, or layoff and furlough, or both?
For furlough, I was thinking about in particular.
Yeah, so you can make reductions in the base pay of exempt employees on a going forward basis, as long as it is for an indefinite period of time. And that can change as you get new facts, but at the time you make the reduction, it's supposed to be considering, right, business circumstances have changed, revenues are down, we don't have as much for you to do. We're cutting your base pay from $900 a week to $700 per week, whatever the case may be. And that's fine. What the Department of Labor does not want you to do is yo-yo people's salaries up and down week to week in an effort to save money. If you do that, they will lose the exemption. Now, in terms of furlough, I mean, if you furlough an exemption, if you think back, what is the purpose of an exemption? To keep an employer from having to pay overtime or minimum wage, which is not really going to be implicated here. But if you furlough somebody and they're working 0 hours, or they're working 20 hours where they used to work 40 or 50, even if they're not exempt during that work week for some reason, what is the harm? Because they're not working overtime, right? So in practically speaking, there should not be any problem with furloughing exempt employees, or I mean, I've had a lot of clients that have reduced the base salaries of exempt employees because the alternative is you can't work here anymore right now. Right. And particularly, and I think Kelsey would echo this, we've had a lot of clients where, I mean, they're good folks and they want to treat their people well, and they don't want to put the burden of layoffs and furloughs on the hourly workers while the executives continue to collect full salary. Right. So I've had a lot of clients where the executive team has whacked their pay 50%, for instance. Yeah. And there's nothing impermissible about that, again, as long as you're not doing it for purposes of evading the obligation to pay overtime.
Right. Perfect. Thank you for that, Franklin.
Yeah, okay. Okay, thanks. So we also know that during the last several months, due to the COVID pandemic, there have been several really significant pieces of legislation: the CARES Act, the Families First Act, and then the Paycheck Protection Program, or the Triple P. So I want to take a few minutes and go through each one of those, and let's pull out anything that might be really relevant to our listening audience that has HR implications for each one of those acts. So Kelsey, can you start us off?
Yeah, sure. Happy to start us off. It probably makes sense. We can just sort of take them in order that they were passed. So
Sure.
The Families First Coronavirus Act was one of the first pieces of legislation that came out in response to the coronavirus emergency. And I think one of the big things here is the required leave. I mean, that's one of the biggest HR related provisions that was in the Families First Act. I'll let Kevin summarize the leave provisions of it, and then I'll come back in and we can talk about the tax credits associated with it.
Sure, and we can dig into these more in detail, and I think we probably will, but in general, the Families First Coronavirus Response Act provides leave for two categories of reasons. One is sickness or diagnosis related to COVID, and the other is for childcare needs caused by COVID. And so the first part allows people to take 2 weeks, up to 2 weeks of paid sick leave for several reasons. Those reasons relate to whether that employee is under a quarantine order, under an isolation order related to a diagnosis or suspected contraction of COVID, an employee who is experiencing COVID symptoms and are waiting on a diagnosis, or an employee who is caring for another individual who has any of those first three things going on. The employee can take up to 2 weeks of paid sick leave for those reasons. Second main piece of that is an employee can take up to 12 weeks of leave to provide child care if the regular child care, whether that is school, daycare, grandma down the street, neighbor next door, whatever the case may be, whatever the child care was, if it is not available because of COVID and the employee can't work or telework because he or she has to provide the child care now, that employee can take up to 12 weeks of leave. And there are some provisions that we can circle back to about how much the employees are paid under each of those circumstances. The big takeaway for employers is that the employers get a dollar for dollar tax credit for providing those payments, which is huge. So there's a big incentive for employers to provide this leave, even if they don't have to. And we'll talk about which ones don't have to, which includes potentially healthcare providers. But the employers just take a dollar for dollar credit on their next 941 payroll tax deposit with the federal government for any amounts that they've paid out for this leave. And I'll leave it to Kelsey that, when we circle back to this later, to dig into FICA provisions that do not apply and that sort of stuff. But in broad strokes, that is the leave available to employees under the FFCRA.
So quick question, when did the Families First Act become effective, Kevin?
So the effective date is April 2nd, and equally important is there's a sunset date, which is December 31st. So it's talking about this stuff is sort of difficult, this topic and like the unemployment benefits, because a lot of it is they have sunset dates, like the unemployment benefits from the federal government sunset at the end of July. I am pretty well convinced that if we have a huge second wave in the fall, for instance, a lot of this stuff is going to get extended in some form. But for the moment, if COVID is continuing past December 31st, employers do not have to provide this Families First Act leave at any point from January 1, 2021 forward. If things are not good in the fall, I would expect some sort of extension, but for now, that's the answer.
Okay. Okay.
The CARES Act and
Sorry.
PPP.
Yeah. Kelsey, do you want to tee up the CARES Act?
Sure. So the CARES Act came right on the heels of the Families First Act and was just an incredibly vast, huge, piece of legislation that was pushed through rather quickly. And I say that not in the sense of being critical, but just in the sense that, a lot of times we do have a lot of open questions about the CARES Act. And there's not a lot of answers, in part because, things had to move so quickly in order to get the legislation out there. So if you're feeling a little vague about the CARES Act, it's probably because the CARES Act is kind of vague in some areas. But a couple of the really big, pieces of HR related news in the CARES Act, there was some relief for folks who were impacted by COVID, so that they can take distributions from your retirement plans if you allow them. They're coronavirus related distributions. And the idea behind those was that if you are furloughing or laying off employees, right, they may be financially impacted and sort of be struggling to make ends meet. And so you can allow them to take a distribution from the 401k plan. And there's favorable tax consequences where aren't penalized they might otherwise be for taking an early distribution. There's more favorable income tax inclusion requirements. But that was one piece of relief designed in the CARES Act to just kind of help ease everyone's burden related to that. One of the other big ones that was in the CARES Act, of course, is the Paycheck Protection Program. And I think that probably warrants a whole other discussion. But Kevin, am I leaving out other HR related provisions in CARES that we want to talk about before moving on?
So the only other HR thing in the CARES Act was that is where they stuck the federal unemployment assistance. So
right.
The chunks of that were a continuation of state benefits for up to 13 weeks past the end of when state benefits would otherwise end. So for example, in North Carolina, at the moment, the longest anyone can get unemployment is 12 weeks under state law. So the CARES Act would extend that to 25 weeks. So the other unemployment provision was the $600 additional on top of state benefits. Interestingly, we talked earlier about reductions in hours versus termination or furlough and whether people get benefits. I don't know if they did this on purpose or this is an example of Kelsey saying that they were going very quickly and perhaps didn't catch everything. But the best read of the federal law is that if you get $1 in state unemployment benefits, you get $600 in federal supplement. If you get $350 in state unemployment benefits, you get $600 in federal supplement, which is going to make for some weird results when you're going to have people who have their hours reduced just enough to qualify under state law, who then get dumped on the $600 supplement and are making more than they were making before they had their hours reduced. And then the final piece on the unemployment that was in the CARES Act is they expanded unemployment eligibility to include people who generally aren't eligible, which is primarily independent contractors. Probably seen some references to gig workers, which I think the media just thought that sounded better. But there are gig workers and they are often treated as independent contractors. But I think there are I think the universe of independent contractors goes far beyond gig workers, and those folks are certainly going to benefit from the CARES Act, and that they would be able to apply and get benefits when before this they would automatically be denied by any state unemployment agency. So those are the unemployment pieces found in the CARES Act.
Yeah, and then the other
Kelsey, let me ask you one quick question for clarity. You said that you could take a distribution from a retirement plan. I think you said a 401k. Mm-hmm. A lot of medical practices have a 401k and a pension profit sharing plan. So can you take a distribution from your pension profit sharing plan as well?
So the rule is actually, so you can't take an early distribution from your pension plan. So, a lot of medical practices have a cash balance plan. You cannot take an early distribution from the cash balance plan. under this CARES Act distribution. It only applies to your 401k plan. If you have a profit sharing plan that's not a pension, the early provisions apply to that. However, let's say that you are already eligible for a distribution from the cash balance plan. If you do take that distribution and you're a qualified individual that was impacted by the coronavirus, you do get the more favorable tax treatment for that distribution, but there's no early withdrawal permitted from that cash balance plan. So the answer to your question, Franklin, is kind of.
Kind of. Okay. Yeah. Oh, thank you for the clarity. Okay. So I didn't want to interrupt you, but just needed that clarity. So let's dive into a little bit more on the PPP.
Sure. So I'll start very, very broadly, and then we can dig into particular pieces that you think may be most relevant. But at a very, very high level, the Paycheck Protection Program is a small business administration loan program. You know, the SBA has ongoing loans or loan programs, you know, that have been in existence long before the coronavirus. But essentially, as part of the CARES Act, what they did was just vastly expand that loan program. And essentially, I mean, any business that employs fewer than 500 employees could, and who certified that they believe that the current economic conditions, you know, made a loan necessary to support their ongoing operations, could apply to the SBA for a loan of up to $10 million. But it was also capped at 2.5 times your average payroll costs for a measurement period that was essentially, I'll call it the 2019, you know, measurement period. So you would go, and there's a definition of what payroll costs mean, but you'd go back, figure out what your average monthly payroll cost was, multiply that by 2.5, and you could request a loan from the Small Business Administration of that amount. And of course, but no more than $10 million. So that sounds all well and good, and loans are great, and there are very favorable loan terms. It's an interest rate of only 1%. It's repaid over two years. There's no personal guarantees on this loan. You don't have to give them collateral. I mean, these were very, very, very favorable lending terms. But that's not all, right? The biggest piece of the PPP is that the loan can be forgiven, 100% forgiven, as long as the business uses the funds in a manner that was set forth to qualify for forgiveness. And essentially what it was that you had to use the full loan amount in the 8 weeks following disbursement of the loan to the business. You had to use it for payroll costs, interest on mortgage obligations, rent, and use it all in that 8-week period. And furthermore, you know, at least 75% had to be for those payroll costs. And if you used it in the appropriate manner, then 100% of the loan is forgiven. You just don't pay it back at all. It's essentially like the federal government has paid your bills for those 8 weeks, for that 8-week period. And you can tell kind of from even just how we're describing it and the name of the program, the whole point was to give businesses a chunk of money to keep people employed, right, to protect their paychecks. And hence why 75% of the loan proceeds need to be used for payroll costs. That's a necessary element for forgiveness of the loan, you know, things like that. So that's kind of a very broad, high-level overview of the Paycheck Protection Program. You want to dig in further on things? Oh.
Yeah, I've got a couple of things I want to ask you as a follow-up. In a medical practice, typically you have, you know, the physician owners, and they could be primary care doctors or specialists, and then you have, you know, the administrative staff and maybe some other clinical staff. but the stratification of the salary structure can be enormous because, of course, the physicians are typically at the top of that pyramid and classified as highly compensated individuals or employees. Is there some sort of restriction on how much PPP funds can go to those highly compensated individuals and physicians? You know, can you address that?
Yeah, absolutely. So even in requesting the PPP funds, you can only count salaries or self-employment income of up to $100,000 per year. So your physician owner, you know, if they're making $250,000 in 2019, you still only count monthly income of $100,000 annualized over 2019. And similarly, when we're looking at using the funds for forgiveness, only, I'm going to get the number wrong, it's 850 seconds. So of $100,000, I think it's like $15,385, something like that. Only that amount can go to each individual who's making more than $100,000. Only that amount is going to be forgiven. So that doesn't mean that you can't pay the owner or physician their normal draw or their normal salary. So if they're normally making, you know, $20,000 a month, you can still pay them the $40,000 for the 2-month period. You know, 8 weeks is not exactly 2 months, but I'm using that for shorthand. But $40,000, only $15,385 of that can be forgiven under the Paycheck Protection Program. Anyone who makes less than $100,000, essentially their entire salary cost that you pay or incur during the 8-week period can be forgiven. So that's kind of how they balance it out.
Right. We have a question from the audience. Can the PPP be used for independent contractors, and does that count toward the 75%?
So unfortunately, the answer is no. It cannot be used for independent contractors. It can only be used for employees. Generally speaking, you know, the costs to pay the independent contractors are generally not permitted uses of the PPP loan. The independent contractors themselves can actually apply for themselves and pay themselves with their own PPP loan, but the business that hires them, that's not a forgivable expense for the business that is hiring the independent contractor.
Interesting. Okay, thank you for that. Okay, let's switch up a bit and talk about furloughed and laying off employees and potential benefits. We talked about the emergency, you know, extraction from some funds for your retirement plan, but what about benefits? If you are going to furlough or lay off employees, can you extend benefits or not? Kevin?
Yeah, so that is a Kelsey question.
So it's a Kelsey? Sorry. Oh, okay.
I could answer it 80% right, but we have somebody right below me in this webinar who can do it 100%.
Okay. Super.
Oh, I was going to sit here and go, ooh, let's see what he says. Yeah, I need to start addressing that. So the answer to that question is a definite maybe. Essentially, if you're furloughing workers, you really, unfortunately, this is a plan-by-plan basis. You have to go and look at what their plans, what each individual practice's plans say. You know, many plans for the health plans, they have a certain, you know, threshold requirement of how many hours someone has to be working in order for them to, you know, continue to be eligible for the plan. You have to be sure that you're complying with those requirements. Often plans have a specific provision about folks on leave of absence. And so a furlough, as we said earlier, is essentially, you know, a type of leave. And so it may say that, you know, benefits will continue under my health plan while someone is on a leave of absence of up to 60 days or up to 90 days or, up to 6 months. So you have to look and see what that leave provision says in order to know how long the benefit is going to continue. And the same is true for your health plans, any insurances as far as life insurance or disability insurance, all of those things. You have to go look and see when your particular plan says that their eligibility is going to end. And it's really important. I mean, sometimes people don't want to know the answer, but I'll tell you, it's really important to know it because you don't want to, to be continuing to take deductions for benefits that folks are no longer eligible for, because the insurer is not going to give them that coverage, that they thought that they still had. So it's really, really important to know when coverage under each plan is going to end. That being said, particularly for the health plans, for those listening, many of the providers have waived that kind of actively at work requirement. And so if your particular health plan provider has not reached out and talked to you about it, I would encourage you to reach out to them. If you have folks who are on furlough, just most of them will waive the requirement right now so that you can keep the health plan benefits going until the folks are back at work.
Super. Tina, I think you have a question.
Yeah, no, I was just listening to Kelsey explaining this, and that was super helpful. But I wonder, Kelsey, does this might be a very off question, but does the amount of hours or like the structure of the time asked to be taken, let's say if someone's furloughed and asked to take every Friday a week for the next 6 months, does that how you determine the time, does that impact at all, if at all?
Yeah, that absolutely can impact the result because in that instance, it may be that the hour reduction wouldn't even bring you below the regular threshold, or that, maybe if it's some sort of leave that counts, you can keep counting the hours. It absolutely how the furlough works can 100% impact the outcome.
Tina, do you have a follow-up?
No, I just thought, so it's going to be very important to really structure this accordingly and really think that one through, obviously, right? So I thought that was really important and very helpful point to make. No, thank you. I think there's some chat, but I want to turn to Aubrey in case there's some questions in the chat.
Yeah, we have a question in the chat box, and the question is, if there was not business and the provider went moonlighting and left the practice, if he was replaced by a new provider, can the new provider pay come out of the PPP?
Yes is the answer. So the PPP speaks in terms of full-time equivalents and payroll cost. It does not care who the person is, just that a person is there. So if you fire somebody and replace him or her, or somebody quits and you replace him or her, you still apply that headcount and that payroll expense toward your forgiveness application, even if it's not the same person who you had on board when you made your loan application in the first place.
Okay. Aubrey, you have a follow-up?
No, sir.
Okay. All right, let's switch up again and let's talk about coronavirus in the workplace per se. And so I want to ask a couple of questions. How do you deal with an employee that refuses to come to the office out of fear of being exposed to coronavirus?
So this is tough. I've had this question come up a lot, and frankly, as you would expect, the questions I've been getting about this are primarily from healthcare provider clients because they are the ones that are exempting themselves from the Families First Coronavirus Response Act leave requirements. And so they're telling their employees, we're continuing to see patients. We need you to come do your job. And their employees in some cases are not very happy about that. The simplest answer is, if there is nothing more than fear of contracting COVID, that is not a legally acceptable reason to not come to work and does not provide that employee any special protection. So if the employee is not falling under a leave entitlement under the Families First Act or under some pre-existing law like an ADA leave requirement or FMLA for some other reason, and just says, I'm scared, I'm not coming, an employer can legally terminate that employee and replace him or her. And the situations that I have seen this come up, frankly, the employers, our clients, have been put in risk. The employees are demanding things that are just not workable. Like, I will come do my job, but no one else can be in the building, which doesn't really work well if you're a medical clinic providing patient care. So we sort of work through that analysis, but I've certainly told some of our clients that I suggest you go have another conversation with this person and say, we understand your fear, but we trying to fulfill our mission to provide patient care, and we really need you here. But if they won't come in and you need somebody there to provide the patient care, you can fire that person.
Okay. So let's kind of flip the script a little bit and say that you're an employee that's in the practice or in the business, and you think that you've had some exposure, and probably go to your employer and say, I think I've been exposed. What should you be doing as an employer through that process?
Okay, so if that is the specific thing the employee comes to you and says, I believe I have been exposed, I think the follow-up question is, have you gone to a treatment provider and requested a test? But certainly, an employee with COVID is a direct threat to other employees in the workplace, to patients, to vendors, to customers, to anyone else he or she might encounter. So if an employee comes to you and says, I believe I've been exposed, the answer is send that person out of work immediately. And this ties back in some ways to the Families First Act and the sick leave provisions there, and the right that healthcare providers have to exempt themselves from that act. So most clients that I have chosen, healthcare provider clients, have chosen to exempt themselves from the child care portions of that law only. Now you can, if you're a healthcare provider and you meet the definition, you can exempt yourself from every single leave requirement in that law, sick leave and child care. I would suggest that healthcare providers think hard about whether that's really what they want to do, because one, you pay these people to stay out for 2 weeks on the sick leave, and then you get 100% tax credit, so it's not costing you out of pocket. And two, particularly if you're a healthcare provider, do you want to incentivize people to come to work when they've been exposed and they're waiting on a diagnosis? I would suggest probably not. So in most cases, I'm seeing clients exempt themselves only from the child care. So if that employee comes to you and you haven't exempted yourself from the sick leave provisions, I would send that person away, tell them to go get a test and quarantine themselves for 14 days and explain they'll be paid while they're out. And then they come back with a fitness for duty note from their doctor 14 days later. The other relevant factor here is, so generally the Equal Employment Opportunity Commission is not keen on employers asking a bunch of medical questions of their employees, right? They have provided COVID guidance that acknowledges that this is an unusual circumstance and COVID provides a significant risk to coworkers and patients and clients and customers and all those groups of people. So it is permissible to ask employees if they are suffering symptoms, which, in your example, the employee proactively says, hey, I think I've been exposed. But as a continuation of that thought, you can certainly ask people, pull up the list of CDC symptoms, that is their current list, which keeps expanding. It is permissible to run down that list with your employees and say, have you experienced any of the following symptoms? It's permissible to take employees' temperatures on the way into work. These are sorts of things that would generally not be legal, but the EEOC has said is permissible. So if somebody doesn't self-identify as having been exposed, but they do identify upon questioning as having these symptoms, or you take their temperature and it's over the threshold, I think you could act the same way as if they brought it up themselves and send them away and tell them to go get a test and to quarantine until they have the test results.
Thanks. Aubrey, I believe you've got a couple of questions from the audience.
Yes. One of them was, if a provider has kids in the family and they're worried about COVID and only wants to do telehealth, can you fire that individual? And as a second part, you replace the provider, does that affect your PPP?
So I'll answer the second part first because that's cleaner, which is yes, if you replace that person, the replacement can count towards your head count for PPP forgiveness. And if we assume for sake of argument you're paying the replacement the exact same amount of money, then you can apply the payroll cost to your loan forgiveness application. So that part is easy. On the first part, it depends on what the business needs are. I mean, if you have telehealth work to provide to the provider and he or she can perform the job effectively working only remotely, then there is some obligation that you consider doing that. If that doesn't work for your particular practice, in other words, you don't have telehealth capabilities, or you don't have any patients that want to use telehealth, then sure, I mean, you don't have to be beholden to somebody saying, I just don't want to do the work that is the work that you need done. Now, again, the thing with the kids here, so it says if a provider has kids and is worried about COVID, keep in mind, one, if you haven't exempted yourself from the Families First Act, you're going to have to provide those types of leave. And so part of this turns on, have you told your employees that you're exempting yourselves from that act? If you haven't said that and they ask for stuff that could conceivably fall under those definitions, then you need to let those people stay out for the 2 or 12 weeks.
As a follow-up to, the question isn't really asking this, but just to throw it out there. When it comes to having to replace the provider that you fired, so the SBA did release new guidance that actually talks about the fact that if you have an employee who you either have to fire for cause or who voluntarily resigns, that reduction is not going to count against you as far as the forgiveness. Now, you still have payroll costs that you've got to come up with and, go find. And so maybe you need to hire someone because you need the services or you need the additional payroll costs. But ignoring that piece of it, a simple reduction in the headcount because someone is fired for cause or voluntarily resigns is actually not going to negatively impact your PPP forgiveness. So in that situation, if your other providers can pick up the services, you may not even need to rehire that person. So just to toss that out there.
And Kelsey, I know that, not to take over steel moderator duties, but I know you have some good thoughts around how to maximize forgiveness that might sort of be a nice follow-up to what you just said in terms of how to maximize payroll costs during the 8-week period.
Yeah, sure. Happy to share some of those. I think particularly relevant for the doctor practices, like Franklin already mentioned, many of the practices now have cash balance plans, right? And we know that the cash balance plans have funding requirements. One thing we didn't mention about the CARES Act is it did provide relief from that funding obligation so that any contributions that are due during 2020, you can delay those up until January 1 of 2021. So that's a permitted kind of deferral. However, contributions to your retirement plans, including to a defined benefit plan like your cash balance plan, will actually count as payroll costs if you make them during the 8-week period. So if you have an obligation to fund your cash balance plan and you do so during your 8-week period, that is going to boost your payroll cost and maybe get you over that 75% threshold. Or if you lose a provider, those are additional payroll costs that you already have some obligation to fund and may help increase the amount of your forgiveness. So that's certainly an idea there. The other thing is, if you're looking for payroll costs, nothing in the act, as Kevin alluded to earlier, suggests that the people that you're paying have to be all the same people who you paid in 2019 or earlier in 2020. They don't have to be for the exact same positions. So if you do have needs, special needs that maybe have arisen during this time, you can consider hiring and getting those done. I mean, maybe you're seeing that telehealth is going to be, this bigger, deal, and you need someone to kind of get you up to speed, or get the systems up or get marketing up for that. If you hire an employee to do those things, that's a payroll cost that may be benefiting the practice potentially more than it would have in the past. And so I do think you can use this 8-week period to be really strategic, since this is going to be a forgiven expense.
Aubrey, you have another question?
I do. One of the participants commented in the chat box and said, we have an office policy requiring all patients and staff to be masked. We have patients refusing to wear a mask. What is the legal standing of the patient that insists that they be seen without a mask? What if they say they have a panic disorder and the mask causes panic?
Mr. Shaver, do you have thoughts on this?
Yeah, I do have thoughts on this, although I don't have a firm and unambiguous answer to that. I think that there is a yet undefined question about what constitutes standard of care. And you can look to inpatient care in hospitals, infection control, things like that, as some sort of guidance about how you ought to manage the risk that an unmasked patient presents to your staff, and particularly to the rest of the population in the practice. But I don't think it's a perfect analogy. I think that the best thing I can suggest right now is that you try to accommodate the patient. In this case, the patient who claims to have a panic disorder and that the mask causes panic, by seeing that patient at a special time in a special location, come in through the back of the office, things like that. I think it's probably also going to depend on whether or not the patient claims to admits having been exposed or is symptomatic, or worst of all, is known to be infected. This is not a great answer. But I think in the final analysis, you do what a hospital attorney told me years and years ago, when she was much older than I and I was much younger than I am now. And so when you find a case where you just really aren't sure what to do, do what's in the best interest of the patient, let the chips fall where they may. Maybe, and in fact, I'm sure Kevin and in particular Kevin, is going to have a better informed notion about what the risks are to the practice by refusing treatment under circumstances like this. But this does not strike me as the sort of case where either the medical board or a medical malpractice plaintiff's attorney is going to get up on its hind legs and criticize a physician who took, at least that, and criticize strongly a physician that took a strict perspective, in this case, and did what he or she did in order to try and minimize the spread of the virus through the practice. Kevin, you got any thought on this?
So no additional thoughts on the ethics portion that you just covered. I suppose my thought from the other side is, under the circumstances that we are under, if you make an exception for that patient, I think whatever the percentage is, which we can't calculate, without question, it increases the risk to other patients and staff in that practice by some number more than zero, right? And I suppose I would have concerns that if somebody has made the determination that the safest thing to do is require all patients and staff to be masked, and an exception is made to that, if there's some outbreak or contamination within that practice, are you exposed on some sort of general liability claim or workers' claim or some other sort of claim where the argument's going to be, this practice did not do everything it could do and knew it should do to protect me because it made a determination the masks were required, but then when people want to wear them, they didn't make them wear them. I suppose that's the only additional thought I have is you're probably taking on some claims exposure by not enforcing it uniformly.
Tina, do you have something to add?
No, I just had a thought. And Steve, sorry, did you want to add to that or?
Go ahead. I'll circle back around to Kevin. If
no, I just no, so I just had a thought as I was listening to Kevin. So I was thinking, so these are typically the situation when you would need then in order to make sure that legally you're making sure you're a safe environment for all the other patients, right? Kind of like nudge in the way that you come up with some sort of way of accommodating that patient like separately or something like that, right? That would be the way to go about it. If I get you correctly. So there's no legal standing in.
Right. I mean, I think Steve said several things that are useful to consider. Is there some way to accommodate this particular patient that minimizes exposure? Could you set an appointment 30 minutes earlier or 30 minutes later than the practice is otherwise open or closed? Could you potentially treat this person through telehealth versus in person? I'm probably not the person to run down the list of all scenarios in which you might be able to keep a patient segregated away from staff and other patients to the extent possible. But whatever those ways are, I suppose that's what I would think about in trying to evaluate what to do here.
Tina, do you have another question?
No, it was just a thought as I heard.
Okay.
I have to say, so Steve's audio is coming across a little weird, so I'm not sure everybody caught everything that was said, but I think we can recap that because I thought that was probably some important suggestions that were embedded in what he was saying. So
okay.
Just want to put that out there as well.
Well, we're at just about time here. I have one brief question, maybe for Kelsey, real quick. Are there any liability traps that we should be aware of as businesses are coming back online? I know the state is at 5 o'clock today moving back to their second stage. So are there any red flags we need to be aware of that we haven't talked about?
Sure. I think that Kevin started to really address some of them. As far as, bringing people back to work and deciding, how, what is the safest practice to do so. Kevin, do you have other thoughts on, other than, protecting the employees?
No, so, I mean, healthcare providers, I sort of reflexively think are probably in a better position than other businesses because many, maybe most of them, maybe all of them, have continued to operate in some capacity since the beginning of this, right? So there's already been a lot of thought put into how do we protect our employees and how do we protect our patients and how do we protect other people that we might encounter. At the risk of being generic, I suppose my advice would be that whoever is running the practice, sit down as a group and think about what are the particularly risky things for our employees and our patients and others, and how can we thoughtfully address those in a way that doesn't eliminate but minimizes risk. And I would suggest that putting that in some sort of written memo and tucking it away could have some usefulness in the future if something doesn't work out the way that we hope it will. So just from a general litigator standpoint, I think it's probably useful if something bad happens later to be able to go back and say, we regret that happened, but we put a lot of thought into how we were going to do this safely as reflected in this written document that we created at the time. That's the only, particular specific advice I have beyond what healthcare providers have probably already been doing. I mean, one of the benefits of being a healthcare provider is understanding how disease works and how disease spreads and the importance of sanitation and the importance of PPE and wearing gloves and wearing masks and cleaning things. I think in a lot of ways, this industry is best positioned to reopen or to expand what has already been an open business versus a lot of other businesses that don't have that experience or base mindset. Steve, do you have any other thoughts on that?
Only to reiterate it, I think that you're exactly right that gathering your thoughts in consultation with all your providers, and then writing down your conclusions and creating a policy is going to put you in a far stronger position further down the road than if you find yourself facing some sort of a complaint. And the best that you can say under the circumstances is we played it by ear and did the best we could. Much better to be able to say we thought about it ahead of time and work out a strategy and put the strategy down on paper, taught it to everybody, and did our best to make everyone comply with it.
Super. Guys, we are at 2:01, so we're at the end of our time. I want to thank everybody for their participation today, and I'm going to give it back to Tina for the wrap-up.
You're muted, Tina.
And I said the best things. I'm so sorry. So I just want to say thank you so much to Kelsey Mayo, to Kevin Siglowski, and Steve Shaber from Pointer Scroll to be with us today. This concludes this week's Power Session. Thank you so much to all of you who were in the audience, or thank you to those of you who will record, or rather listen to the recording of this next week. Join us again next week. We will focus on diabetes, so we hope to see you then. And with that, stay safe. Thank you for all that you do, and happy Memorial Weekend.